A baby with a growing head. Is it water, bone, blood, or just genes? Sometimes a big head is the first sign of something serious. Sometimes it's nothing at all. In this video, you won't just memorize causes of macrocephaly. You will meet them one baby at a time. And I'm Dr. Ask, turning stress into success. Let's begin the story. Case 1, Hydra, the water baby. Hydra cried more than usual. Her soft spot was swollen, a bulging fontanella, and her eyes seemed fixed downward, the classic sun setting sign. Then a CT scan revealed the truth. Her brain chambers, the ventricles were full of trapped fluid. Yes, she had hydrocephalus. The blockage was in the cerebral aqueduct called aqueductal stenosis. A VP shunt drained the fluid and her head stopped growing. Yes, she finally smiled again. So, in Hydra case, the big head was due to fluid accumulation. That's macrocephaly from hydrocephalus, one of the most treatable cases. But what if it's not fluid, but the bones themselves growing thick and wide? Let's meet Benny, the bone growth baby. Benny's head was large, but so were his features, short arms, short legs. His skull bones were thick and heavy. An X-ray confirmed the diagnosis that achondroplasia, the most common skeletal dysplasia. The head was large due to bone, not fluid or blood. The foramen magnum may be narrow and the cranial base is underdeveloped. That's why macrocephaly happens here. It's from bone overgrowth. And sometimes the bones don't just grow, they try to save a life by making blood. Yes, let's see the pal fighter Zoya. Zoya looked tired, her skin was pale, her head looked wide, bulged forehead. She had beta thalassemia major. Her body wasn't making enough hemoglobin, so it tried to produce blood from unusual places, even from the skull bones. Yes, her skull expanded. X-ray showed the classic hair on end appearance. This wasn't fluid or brain, it was extramedullary hematopoiesis, that is, blood cell production inside the bone. As you see in Zoya case, macrocephaly was due to bone marrow expansion, a classic feature in beta thalassemia major. But what if it's not fluid or bone? What if the brain itself is just too big? Let's meet Arya, the brain builder. Arya was calm, no fever, no vomiting, but his head circumference was far above average. MRI showed increased brain tissue volume, not fluid, not blood, it's a brain tissue. This is called megalencephaly. Sometimes it's harmless, like in familial megalencephaly, but sometimes it's part of conditions like Tay-Sachs, Canavan disease, Fragile X syndrome, or Alexander disease. So, Arya had macrocephaly from brain overgrowth, that is megalencephaly. It's a key category of macrocephaly with genetic links. But not every big head is natural. Some come with hidden danger, a bleed we can't see. Let's meet our silent bleed baby Rahul. Rahul became sleepy and stopped feeding. He vomited twice, and then a CT scan showed a crescent-shaped bleed between the brain and skull. Yes, that is subdural hematoma. There was no history of trauma or fall. In babies, this often raises concern for non-accidental injury or child abuse. Macrocephaly due to bleeding is a red flag and urgent help is needed. Rahul's case shows macrocephaly from subdural hematoma, which is a critical cause often linked to trauma. And finally, not all big heads are problem. Sometimes they run in the family. and need no fixing at all. Baby Dev, the family pattern. Baby Dev had a big head, but he was walking, talking, and growing normally. Then his doctor checked the family. His dad had a big head. His grandma too. Yes, this is familial macrocephaly. It's benign. The child is otherwise normal. No imaging, no treatment, just reassurance. Baby Dev's macrocephaly was simply genetic, that is, familial macrocephaly. No danger, just big like his family. Six babies, six stories. Let's wrap it up with what matters most: what to check, what to treat, and when to worry. Here is the summary table, you can go through it. So, not all big hurts means danger, but every big hurt needs a closer look. Is it brain, fluid, blood, bone, or just family?